Good. All right, so let's start. All right, so there's no one new, but this is what we usually do. We just try to talk about important topics. So it'll make us, either be a revision for us or something new to learn. So I think today Stardock is going to, hey, what do I call you? Do I call you doctor or do I call you Stardock?
Stardock is fine.
Stardock, all right. So he's going to share with us the topic about how to share health issues through music, right?
Yeah.
And I think that's quite important for us because we have to not just treat patients, but teach them how to take care of themselves. So anyway, I think you can start and.
Okay. So I would start with a bit of an introduction of myself and what I do. My name is Dr. Ibe. Can you hear me?
Hear you. We can hear you.
Yes, we can hear you.
All right. My name is Dr. Ibe Chiemeze. I'm a medical doctor based in Nigeria, and I'm also a rap artist. I do rap music, and so what I do basically is to use rap music or music in general to help educate people about important health issues. And I've done quite a number of, I'll call it medical musical works. And the latest being 2 songs on coronavirus that was featured, that was widely circulated in the media. I've also done stuff on malaria, hypertension, female genital mutilation, which is a health issue in my country, Nigeria, and sickle cell anemia, and a host of others. So, how did I start? Why did I even choose to do it in the first place? Is what I want to talk about. So, while going to medical school, I saw patients die, and a lot of these deaths, for me, were quite avoidable. Imagine a patient coming from, let's say, a cerebral hemorrhage as a result of elevated blood pressure. The patient wasn't aware that he had a high blood pressure over a very long period of time till one of the cerebral arteries just burst open and the patient eventually died. Now, I also saw people die from avoidable illnesses, sickle cell anemia, things that could have been prevented if they were aware. And sadly, I tagged, or rather, I attributed these deaths to ignorance. A lot of them were unaware. So I thought about how to go about telling people about diseases in a way they could understand. Then, secondly, I watched a lot of health education sessions. A lot of health education sessions involving doctors, nurses, pharmacists, and healthcare workers. And I wasn't comfortable with the way they were passing out information. I'll give you an instance. In the course of our training as medical doctors, we tend to use a lot of specialized words. You rather say hemorrhage than bleeding. You rather say hemorrhage than bleeding. You rather say something like a hyperpigmentation than changing color. These things you don't even know when you do them. Now, you're talking to a common man, someone who probably has a low level of education, and you're telling him hemorrhage, you're telling them hyperpigmentation. This person does not understand you. At the end of the day, you are going to talk, and after that, you move away, and he goes back to what he was doing because he did not understand. So I thought about a means to communicate to people using a universally understood language. And that was where music came in for me. I rap, I write poetry, I sing. So you don't even have to be a Nigerian to understand music from Nigeria. You don't have to be Russian to understand like Russian music. As long as the sound is right, you can easily relate to it, you know. And that was how I started uh, writing songs that are health based. The very first song I did was during my years as an intern doctor. I had a patient who came in with late stage breast cancer. He had a family history. He noticed a lump when he was still at the benign stage. She didn't do anything about it. By the time she came to our clinic, there was already metastasis. So I knew that if I could put this in a song, put it out there, a lot of girls are going to relate with it. A lot of girls will take precautionary measures. So that was why, you know, I started doing music. You know. And we talk about public health, the health of the public. You're trying to reach out to the masses. You're trying to get the widest possible reach. You're not going to get the widest possible reach by talking to people in a term they not understand. That's why I chose music. That way, I can reach out to a wide range of people. And the influence of music on public health, from my own experience, has been amazing. Because every day I check my my inbox and I see people tell me, "Doctor, thank you very much. I saw the song you did on this particular illness, and I've modified my lifestyle." Some of them tell me that while they are going about their normal business, the song plays in their ears and they make changes. You know, I remember doing a song about kidney failure, and I talked about the use of heavy metals in creams. I called certain heavy metals in body creams, and I made a song about it. A friend reached out to me and said, "Doctor, I was about to buy a song, and your song, I was about to buy a cream and a soap, and your song played in my ear. I checked the content of the soap, and it had mercury, it had this and all of that stuff, and that was why I left it." So I think the public in my country, they are bored with the way medical information is being passed out. Sometimes medical information is passed out and they end up being scared. They end up being afraid. So with music, I'm able to take out the problem of boredom. I'm able to take out the problem of fear. And at the same time, I'm able to give out proper information. So if you check my social media handle on Instagram, Twitter, maybe I would have to write that out somewhere in the chat box or something. It's a Stardock official. I don't know if you can see it over there. Sorry, 1 second. Official. That's Instagram. Can we see it, please?
We are seeing it, yeah.
Yeah. Stardock official. That's my Twitter handle. Then on Instagram, it's same Stardock official with an underscore. Instagram. So if you check those handles, that's why you see quite a number of my works using music as a tool for health education. And I've recorded quite a number of successes. Something is an echo. Hello.
Uh,
Okay.
I think it's Amazing Grace.
Yes, yes. Maybe.
Hi. Hey, could you mute yourself?
Hello. Can I go in? Hello. Can I go on?
Yeah, I think you can.
Okay,
You're
so,
great.
Going good.
So I've recorded quite a number of successes in terms of education of the public and in trying to dispel wrong information, wrong medical information. And most important of them to me was when a drug abuser reached out to me after she saw a song I did on drug abuse. And she sent me a message and said, I've been abusing pentazocine for quite some time now. What do I do? So I helped her get professional help. Not over the internet, because after we talked, I linked her up to some specialists who are involved in managing drug abuse patients, and we started out something, and she's been drug free. She's been sober for quite some while now. I think about 6 months, getting to 1 year, I guess. So that was really heartwarming for me. Then also, I have been able to do collaboration with fellow healthcare professionals, with pharmacists, with nurses, through music. These are people too who are musically inclined. These are people who are also musically inclined. I get them, we go into the studio, we make music, and we put out there. Then in October 2019, I was involved in a breast cancer awareness in 2 states in my country. And we reached out to, I think, over 5 to 10,000 people, creating awareness. I worked with some organizations, some non-governmental organizations that had the backing of some people in government, and were able to carry out music rallies, screen people for breast cancer, and also those who needed further treatment were taken up from there, and treatment was started for them. We had quite a number of survivors. So I look at all these things and I'm happy. I look at these things and I'm fulfilled. It just gives me that good feeling that, okay, we are doing something correct, we're doing something different, we're doing something unique, and we're getting appreciated for it. So amongst us here, there are doctors. I think that we have doctors here, we have medical students here as well. I think at this juncture, I would want to urge us. If you go to the social media space, if you go to the internet, there's a lot of wrong information. There's a lot of wrong information being pushed out there, wrong health information being pushed out by people who do not have even the slightest training in medicine. At the end of the day, who suffers is the general public that suffers. Now, one thing that is even more painful is the fact that these people have huge followership on social media. I'll just give let me give an instance. Let's say imagine someone that has 10 million followers or 1 million followers on Twitter and comes to tweet a wrong health piece of advice. You know that a lot of people are going to follow that. So
Of course.
So I want to enjoin us while we are in training, while we are working. Let us use our social media handles. Let us use our social media influence to advocate, to educate, and to put out the right information. Someday, I don't think we've gotten it right at the moment, but someday, with consistency, we are going to get it right. We should do this for the sake of the profession, and most importantly, for the sake of the common man on the street who just gulps down whatever information he comes across. And also, you also have to understand that people will believe you because you are a doctor or a medical student when you talk about a healthcare issue. So why don't you use your platform and push out proper information, and give us a healthier world? So that's what I have to say on this topic for now. I don't know if there are specific questions, then I can answer them. Thank you very much.
We can't hear you, Jehosin.
Right, sorry. Does anyone want to add to it? It'll be nice. And also I wanted to ask, like, how do you actually implement this idea? I mean, like, you can do music, but how do you share it with people? Do you like go give it in schools, or do you talk in schools?
Okay, this is how it is for me. It's actually in two phases. There's the online aspect and there's the offline aspect. On the online aspect is where I after making music and shooting videos, I put it out on Instagram, on Twitter, on Facebook, on YouTube. I reach out to people who have much more social media followership than I do to also reshare. I get my friends to repost. That way, it gets a large audience. Then offline, I work with a number of people who do healthcare awareness programs, who do healthcare advocacy. So we go to schools, we go to communities, and we reach out. We teach them basic preventive measures for diseases. And we end those sessions with music. So we don't just go into the communities and start singing. We don't just go into the communities and start singing. It's like we go into this place, we talk to them, we give them basic medical lectures, demonstrations, and all of that stuff. Then we say, okay, just before we leave, there's a twist to this whole thing. So start up, do your thing. And then I come in with the music aspect. So that's like the icing on the cake for it. Because the truth is that there are quite a lot of things that you cannot cover in a 3-minute song. And when I put out my healthcare awareness songs, I do not just leave it at that. There's usually a footnote. There's a footnote that follows that goes into specifics, so that you don't just stop at listening to the song, you read what I'm talking about as well. There's a contact where you can reach me, and we take it up from there. So that's what it is for me. There's the online part and there's the offline part.
And how do you control the misinformation that goes around?
Well, the since I don't own the social media space, I don't have any power to control misinformation from various people. All I can do is to put out the proper information, make it circulate as widely as possible, and also put out my profile there as a certified medical doctor. That way, an individual who reads, who sees what I put out and looks at my profile, so this guy is a doctor, then this guy is more believable than when like some other person, maybe an engineer or somebody who doesn't have basic education, says the same thing or something along that line. I do not have, I mean, I'm not Mark Zuckerberg, or I don't own WhatsApp and Facebook. But then what can I do? I can only do my part and encourage my colleagues to do same, and that's it. I'm a very artistic person. I'm a I'm a very artistic person. I love art, poetry, music, uh, visual arts. I encourage my friends. I encourage my friends to do art and to do art that has message. I've been able to inspire quite a number of younger colleagues, to do poetry. And some of them, while they do their poetry, they also address, health issues as well. And that's what it is. Recently, I worked with a friend who did visual art that was coronavirus themed, and I took a picture in front of, like, with the coronavirus picture behind me, and then I said, very soon coronavirus will be behind us. So that was my own way of supporting my friend who was doing that. So I'm unable to control misinformation, but I can as much as possible prevent it by putting out the right information and encouraging other healthcare professionals to do same in whatever form that they can. I think if we all do it, somehow, someday, we'll get it right, and we'll kick out all the misinformation happening all around us.
That's nice. Because usually in India we have WhatsApp, a lot of WhatsApp problems. We have like uncles meaning like, older generation. They tend to give false information and it gets spread in one community. And you tell them whatever you want, they are not going to change their mind. So it becomes a problem. So I was wondering, what do you guys do? But then when I tell them, right, for diabetes patients, they shouldn't eat too much. It's not just remove sugar, but you shouldn't eat too much. They don't get it. And they are not willing to change. They have this mentality that you can eat vegetables and diabetes will just go. So I don't know what to do.
Well, I mean, maybe you agree with me that I think it's a global thing for the older generation.
Yeah. I think
It's
they
a
got
general
a
thing.
they got a set mentality and they just do not want to move from it.
It's a global thing. I mean,
It's a
even
global thing.
sometimes my mom sends me some messages, and immediately the message come in. I said, no, this is false. This is false. I said, this is false, please. This is false. You cannot put out such message on the rest of them. So the best you can do, you just have to keep talking. I mean, they are the older generation. A lot of the things they do it based on life experiences over years. It's not so easy for them to change abruptly, but with consistency, we do this because we love them. That is the truth. That's why we do what we do. We do this because we love them. So we keep telling them, and you just never get tired of telling them until, trust me, if you tell them 100 things, they are going to pick out a few things. They may not pick out everything you're talking about. They will just pick out a few things. And who knows, that particular one they picked up may just be what will save them in the future. That's it.
Yeah.
So our parents are very lovely people. We love them, but we just have to do what we have to do for them.
Right.
That's it.
It was nice hearing it, man. Thanks for sharing. So shall we have a closing prayer? Or does anyone else want to add anything quick?
Yeah, okay. I want to really thank each and every one of us for attending. Well, we have a very few turnout today because most of us are preparing for exams, and some of us today, I don't know, today is more like a closing period when some people have tests, exams, and some of the doctors that are on our trend, they have a call up duty today. So that's why we have some low turnout today. And by next Friday, some of us will also be available. Yeah, and I want to urge each and every one of us to kind of to keep sharing our views, to keep sharing our messages, because in just like he said, by sharing, because some of his videos and his message out there, it has already gone a long way to educate and sensitize a lot of people, a lot of the laymen out there who don't really know a lot about health. Talking from experience from what you said, and some people, just this evening, I spoke to a girl. She sent me a test result, and this test result, it shows she did this in Russia, we call it Uzi. She did an she did an ultrasound and did some lab tests and all those kind of stuff. So I told her, from the interpretation of the test you sent me, you have ovarian cysts. And she was like, what is ovarian cyst? I don't even know how to start explaining, like, because this is somebody that, okay, do you need to go scientific? She's asking you what is ovarian cyst. Okay. And maybe you need to go, if you want to define, are you going to make the definition of what ovarian cyst is? Because she doesn't even know what ovarian. Some of them will be like, okay, ovary, I know ovary, what is a cyst, and they need like a very plain definition, a very layman definition, a very street, like in a street way, like street, what the kind of language you use on the streets, probably broken English or pidgin English, to explain what, to pass across the information, because you are no longer in a classroom, you are no longer in a professional environment, you are talking to a layman. So these are the things that we really need to work on our delivery, how to really, because our aim here is to save lives. And if you cannot communicate effectively, if you cannot pass across your no matter what the kind of semantics you have as a person, as a professional, if you can't pass information or explain some detailed things to your patients, to be a problem. So thank you so much, Dr. Chimize Ibe, Star Doc, for this. And I believe that he has some of his songs and some of the work he did. He probably will share it in our group, and from there we can look and see what he has done. Yeah. So we can, yeah.
I will, right? I will.
Yeah, in no distant time, we will have our Instagram. We also have our Instagram page, and also website is going to be developed soon. We just started, and I believe as time goes on, we'll have more people that will join, people that are interested, that are inspired to get involved with whatever we are doing. So thank each and every one of you for your contribution.
Yeah. I would want to ask, like, this Zoom meeting, is there a way it can be recorded? Like,
as I'm talking, I think it's being recorded right now.
Okay, if you could still share it on.
Yeah, I'll get. Yeah, I
page.
think it's being recorded. We get. Yeah. As time goes on, maybe from next. Ideas are coming. More ideas are coming into this, and a lot of people are joining. And just to let you know, we are not all from Russia. There are some of us who are doctors already, who are from Israel. We have some doctors who are from UK, from Ukraine, from Saudi, different places. You from Nigeria, okay? People from different places who are from India. So all of us, we don't really stay. So we have we all come from different time zones. Okay, like right now in Nigeria, I think it's 3 o'clock, 3
It's
p.m.
like,
now.
yeah, 3 p.m. thereabouts.
Yeah, someone else, for someone else is 8 p.m. So someone else, so we are all from different places around the world. So we just started as, colleagues. When we started from university, from schools, here in Russia, we all come from different countries. So when we graduate and we go back to our home and where we are practicing, we continue with this. So that's how it is. Thank you so much. Please feel free to invite your colleagues who are doctors who want to be involved in this.
I'm already doing that.
Yeah, we can add them to the group. Just anybody who wants to get involved, who has something to share, like who have probably who have NGOs or who have maybe information just like you have to share to the world in terms of just to make our profession better and more interesting, just like you did for us today. Please feel free to get them. It's more like a doctor and professional trend. Thank you so much for your time.
All right.
Thank you so much.
Very much.
Hey,
Thank you.
Joseph, over to you.
All right, so let's pray and we shall close.
Okay.
Lord, thank you for this day, Lord. Thank you for this beautiful message, Lord. Thank you for the knowledge you have given us and shared it across the globe. I pray for everyone who is suffering with coronavirus too, Lord. And I pray that you would make their suffering easy, Lord. And thank you for keeping us safe through it all. In the name of Jesus, I pray. Amen.
Amen.
All right.
Thank you all.
Thank you very much.
Thank you very much. Yeah. Have a nice time. Yeah.
Bye,
Great
guys.
hearing from you. See you. Bye-bye.